Hi, I'm Mike Zimmer with AVI Systems. I've been in the audio-visual integration business for about 27 years, and 26 of those 27 years have been focused on the medical industry. I've been fortunate enough to work with some of the most creative, innovative healthcare providers in Minnesota. Well, telehealth has many forms. Could be any number of things, but in the end, it's really just taking care of the patient and using the most efficient, effective means possible to do so. So telemedicine has many forms. It can be for stroke monitoring, gives the physician or healthcare provider the ability to see how a stroke victim is after having a stroke and going through therapy. It can also be used for prenatal care, prenatal monitoring, that type of thing, checking your vitals. It has a lot of different applications that it can be used for. That's important in those areas because a doctor can physically see, the tells that they're looking for, right? And that might prompt them to bring them in for additional tests or whatever the case may be. In terms of how telemedicine really helps the doctors help the patients, it really reduces the in-clinic visits. That's really the primary reason for it. So take into consideration a person that may live in a rural situation. What does a doctor visit mean to them? That could be maybe a 2 to 3 hour trip into a clinic for a routine visit. That's a big commitment in time and probably expense in some situations if you have to go into a city and stay overnight or whatever that case may be. This could alleviate a lot of those issues. I think what I like about it most, and actually this is the part of the job I love most, is collaborating with physicians to develop new technologies and new ways of getting things done. It's always very exciting because you can see how very vested they are in the patient's care, and that's what makes it all worthwhile. I think in the future what you're going to see is there's going to be a lot of healthcare providers that are going to find that it's not a nice to have, it's going to be a need to have. For more information, subscribe to our YouTube channel, and thank you for watching.